Today we are navigating lower back pain in the 40s, understanding causes, prevention, and management. Lower back pain is a prevalent and often debilitating issue that can affect individuals across various age groups, including those in their 40s. As we navigate the challenges of this particular stage of life, it becomes crucial to understand the multifaceted reasons behind lower back pain and explore effective strategies for prevention and management. In this video, we will delve into the diverse causes of lower back pain in 40-year-olds, shedding light on both lifestyle and physiological factors that contribute to this common ailment. Lower back pain is a complex and widespread health concern that impacts a significant portion of the population, with an increased prevalence among individuals in their 40s. The lower back, or lumbar region, plays a crucial role in supporting the upper body, facilitating movement, and bearing the stresses of daily activities. As individuals approach their 40s, they may experience a range of physiological changes and lifestyle factors that contribute to the onset of lower back pain. Physiological causes. Degenerative disc disease (DDD). Any of the leading physiological causes of lower back pain in the 40s is degenerative disc disease. This condition involves the breakdown of the intervertebral discs, the soft, cushion-like structures between the vertebrae. As these discs degenerate over time, they may lead to pain, stiffness, and reduced flexibility in the lower back. Herniated discs. Herniated or slip discs occur when the inner gel-like substance of a disc protrudes through its outer layer, putting pressure on surrounding nerves. This can result in localized lower back pain, as well as radiating pain or numbness down the legs. Osteoarthritis. Osteoarthritis, a common age-related condition, can affect the joints in the lower back. As the protective cartilage wears down, bones may rub against each other, causing pain, stiffness, and reduced range of motion. Spinal stenosis. Spinal stenosis involves the narrowing of the spinal canal, often associated with aging. This narrowing can put pressure on the spinal cord and nerves, leading to lower back pain, numbness, and weakness. Lifestyle factors. Sedentary lifestyle. In contemporary age, many individuals find themselves leading sedentary lifestyles, particularly those engaged in desk jobs. Prolonged periods of sitting can weaken the muscles that support the lower back, contributing to pain and discomfort. Poor posture. Maintaining good posture is essential for spinal health. Poor posture, whether while sitting or standing, can strain the muscles and ligaments in the lower back, leading to chronic pain over time. Lack of regular exercise. Physical activity is crucial for maintaining the strength and flexibility of the lower back muscles. The absence of regular exercise can contribute to muscle imbalances and weakness, increasing the risk of lower back pain. Excess weight and obesity. Carrying excess weight places additional stress on the spine, particularly the lumbar region. Obesity is associated with a higher risk of developing conditions like degenerative disc disease and osteoarthritis, which can contribute to lower back pain. Stress and mental health. Mental health can significantly impact physical well-being. Stress, anxiety, and depression can contribute to muscle tension and discomfort in the lower back. Additionally, coping mechanisms such as poor sleep and unhealthy lifestyle choices may exacerbate the issue. Prevention and management. Regular exercise and strengthening. Incorporating regular exercise into one's routine is crucial for preventing and managing lower back pain. Activities such as walking, swimming, and core strengthening exercises can improve muscle tone and flexibility, reducing the risk of pain. Maintaining a healthy weight. Managing weight through a balanced diet and regular exercise is paramount. Weight reduction can alleviate stress on the spine, reducing the likelihood of degenerative conditions that contribute to lower back pain. Ergonomic practice. Implementing ergonomic practices at work and home is essential. This includes maintaining proper posture while sitting, using supportive chairs, and adjusting desk setups to minimize strain on the lower back. Mind-body practices. Mind-body practices such as yoga and meditation can help manage stress and improve overall well-being. These practices contribute to relaxation, reducing muscle tension and promoting a healthier mental state. Proper lifting techniques. Individuals in their 40s should be mindful of proper lifting techniques to avoid unnecessary strain on the lower back. This includes bending the knees, keeping the back straight, and lifting with the legs rather than the back. Regular health checkups. Routine health checkups can aid in the early detection of conditions that may contribute to lower back pain. Timely intervention and management can prevent the progression of certain physiological factors. Physical therapy. In cases where lower back pain persists, physical therapy can be an effective intervention. A trained therapist can provide exercises and techniques to strengthen the core, improve flexibility, and alleviate pain. Pain management techniques. Pain management techniques, including over-the-counter or prescription medications, may be recommended by healthcare professionals. Non-pharmacological approaches such as heat or ice therapy can also provide relief. Ergonomic furniture and accessories. Invest in ergonomic furniture and accessories, such as supportive chairs and lumbar cushions, can create a more back-friendly environment, reducing the risk of strain and discomfort. Mindful movement practices. Mindful movement practices, such as Tai Chi, focus on fluid, controlled movements that promote balance and flexibility. These practices can be particularly beneficial for individuals looking to maintain spinal health. In conclusion, lower back pain in individuals in their 40s is often a result of a combination of physiological changes and lifestyle factors. Understanding the intricacies of these causes is crucial for developing effective prevention and management strategies. By adopting a holistic approach that encompasses regular exercise, healthy lifestyle choices, and mindfulness practices, individuals can not only alleviate existing lower back pain but also proactively enhance the health of their spine. As we navigate the challenges of the 40s, prioritizing spinal health becomes an integral component of overall well-being, ensuring a more active and pain-free future.